Hello, everyone. I'm Dr. Tiffany O'Mara. My pronouns are she and her, and I'm the Director of Outreach Services at Counseling and Psychological Services, otherwise known as CAPS. I manage our preventative skill-based workshops and our community-based programs, run our Building Social Confidence and Taming Anxiety therapy groups, and provide outreach on topics such as stress management, building resilience, and increasing well-being. And I have been at CAPS for 22 years. And here with me today is Dr. Brian Balvaneda.
Hi everyone, I'm Dr. Brian Balvaneda. I use he, him pronouns, and I'm a CAPS staff psychologist supporting mental health services here at CAPS, and I've been with CAPS for 3 years. So today we're going to be talking about how to support students in distress.
Today, we'd like to provide you with some tools and strategies for helping students in the context of all that's going on right now. So we'll start by discussing the current social context and the variety of stressors that are having an impact on students. Next, we'll talk about strategies for supporting students, including suggestions for how to be with someone, as well as what to say and do when a student is in distress. And finally, we'll discuss CAP services so that you can have a better idea of both our clinical services as well as our preventative services, such as our skill-based workshops and community spaces. And this will be helpful in making referrals for students to receive additional assistance. Before we start talking about how to support students, it's important to recognize the social context we're living in at the current moment. There are so many things that may be impacting students and contributing to their stress levels, and ours. It's not just school and academics that are impacting student stress levels. There are a lot of socio and geopolitical stressors that are contributing to distress levels. Sometimes it can feel like it's relentless and something new and terrible is happening every week. And this may all contribute to heightened underlying anxiety for many. This may also be compelling for some students to take action and get involved in protests and other forms of activism while trying to balance everything else that they have to do. So we just wanted to take a moment to acknowledge the very real impact that all of this has had on all of us.
So it's also important to understand the context of what students may be facing in the upcoming 2024 presidential election. According to a study by the American Psychiatric Association, only about 1 in 4 adults has spoken with a mental health care professional, despite most adults reporting feeling particularly anxious about current events. Of these anxieties about current events, 73% reported that the election in particular is making them feel anxious. So there is a need to identify people experiencing stress that can be helped. Within our schools, the APA has showed that a large majority of Americans, about 84%, believe that school staff play a role in identifying mental health concerns, while 45% also reported believing school staff have been trained in identifying these concerns. We recognize that for many school staff, this is not your job, nor have you been trained to do this. And so, as we're increasingly hearing about more staff wanting to identify tools to manage these stressors and navigate these situations because of the frequency in which you may encounter them, we also want to acknowledge that it's okay to not know how to identify or manage these concerns. But if you're watching this and you're looking for tips and tools to do so, we hope that we can provide you at least some idea and sense of how to feel better equipped to know what to do. And so we want to start with recognizing signs of distress. Here we focus on signs that a student is experiencing mild to moderate distress. Clusters of symptoms may indicate more distress and be more likely to impact someone's functioning. Or perhaps there is one symptom like feeling anxious or worried, but it's really severe and causing a lot more difficulty in that person's life. Think of this as a scale or a seesaw. A single sign in and of itself may not be coming up strongly or presenting a concern for the student or in your experience of the student. But if there are more things they're struggling with, it may be an indicating a more significant mental health concern for the student. Alternatively, one single sign that is creating a lot of issues may be going on for a long time, or appears to really be bothering the student can be quite concerning. This can be helpful to keep in mind whether to refer for additional support or considering offering space for the student to process these concerns with you, especially as it may relate to current events. These are also indicators of a student who may be in high distress. If you observe any of the signs on the left-hand side, these are good indicators that they are likely struggling and that you may want to connect with them for additional support. So these can include feelings of hopelessness or thoughts of worthlessness, engaging in self-harm, risky behaviors such as risky sexual activity, behaving bizarrely or seeming like they're not thinking clearly. Excessive worry that is difficult to control causes a lot of anxiety, fear, or may even lead to panic attacks, mood swings, binge drinking or drug use, and deteriorating hygiene and overall self-care. In this red box, these circumstances are ones that you'll certainly want to be getting help for. These include violent threats against other people, thoughts of dying, thoughts of suicide, or students who seem to be not connected with reality. And so we'll be talking towards the end of the presentation about how to reach out about students of concern or get more immediate assistance.
Once we identify that a student is experiencing distress, this brings us to how can we provide them support. And we've broken this down into 3 steps. The first is how to be with someone. Then what can you say and do? And finally, how to refer for additional assistance. These steps may seem like common sense, but we find that in the heat of the moment, when we're faced with high emotion, it can be easy just to jump to problem solving. So just because a student has tears or expresses anger, you don't need to jump straight to refer the student to CAPS. You can provide a simple yet very effective response to the student. And many of you will have experience with these tools, which is great, and that's going to be really useful for you. And the good news is that each step is simple by itself, but when put together can be like pearls of wisdom that will go a really long way to help calm the student and provide a holding space for them. So we're going to take you through each of these steps. So first we'll discuss how to be with someone, how to set up a caring environment, and how to provide empathic support. When you have concerns about a student, it's okay, and in many cases, it's even important to speak up and express your concerns. But I'm going to share some tips that may help reduce defensiveness so that they can be more open to hear what you have to say. So first, be aware of how you are feeling. It can help to take a deep breath so that you can be a calming presence. It can help to be mindful of how you are going to speak with them, and also consider when and where you will have this conversation. You don't want to catch them off guard by starting this conversation. So be sure that you're in a private space, that there's no one else who can hear or will interrupt your conversation. And think about the presence that we want to hold with them. For example, invite them to come into your office, put down their backpack, have a seat, find a way to physically create a space that feels inviting and relaxing. Nonverbal communication is a really important part of communication, and ROLES is an acronym with some helpful nonverbal suggestions. So relaxed, have a relaxed body language, open position. So keep your body open instead of closed off. Leaning forward helps to be engaged with the student, making eye contact, and then squaring up, which means your shoulders line up with your bodies, line up with your knees. And so this nonverbal stance can naturally change the way that we can communicate, and it really helps the other person to engage with you.
A lot of what it means to be supportive in a challenging mental health situation can bring up concerns about what to do. But it's more about how to be and allowing yourself to sit with the person and provide support. Sometimes our own anxiety arises, and a natural response to anxiety is trying to fix it or do something that addresses the situation or alleviates the anxiety. When we immediately react to stressful or crisis situations, we tend not to provide the best support because we may be focused on trying to manage our own reactions. In high stress situations, our brain is wired to hyper focus on the stressful thing, which can be helpful in the event of an immediate emergency, for example, being attacked by wildlife, or not helpful when a situation may require sensitivity or careful planning, like attending to someone that is having a panic attack. Instead of an immediate reaction, we can aim to respond with intentionality. Taking a moment to remind ourselves of a few important ways to be with someone, as we'll discuss in a moment, goes a long way and can provide a kind of some empathic support that will also give us some time to think and then identify a meaningful response that can include a helpful recommendation. There's often more time to respond than we initially perceive, and we benefit from giving ourselves this time.
Next, we'll explore what we can say and do to provide support to a student in distress. You aren't expected to be a counselor for the student, and we recognize that this is not your role. But if you would like to know more about what to do if you are in a position of wanting to provide support for a student, we hope that these tools can be helpful. And as Brian mentioned, a kind word can go a really long way. When we have concerns we'd like to express, for example, if we notice any of the indicators of distress that we discussed earlier, it can be helpful to use what we call I statements. So without judging the student, point out the behaviors that are concerning and then express how you feel. So for example, I've noticed that you haven't been participating in our discussions as much. And in the discussion board, I noticed that you made a comment about feeling depressed and having thoughts of hurting yourself. Um, I just want to let you know that I'm concerned for your well-being, and I'm wondering if you'd be willing to talk with me and tell me a little bit about what's going on. And so you also want to avoid what we call war words, like you always do this or you never do that. These kind of statements can bring up defensiveness. And it's also important not to criticize the person, but instead to be very specific about the behaviors that you've been observing. Once you've expressed your feelings, encourage the student to talk by asking open-ended questions to find out more about how they're feeling. Yes and no questions are good for getting answers quickly, but you may want to think about using open-ended questions when you want to really engage or motivate someone. Open-ended questions start with words like how or what and aren't answered with a simple yes or no. For example, instead of asking, are you depressed or are you anxious? You can ask them open-ended questions such as, how have you been feeling? What are your thoughts about this? Or please tell me more about what's going on. But if someone is having difficulty engaging in conversation, they're being very quiet, they are having difficulty breathing, or maybe they're experiencing a panic attack, or they seem disoriented, it's okay to switch back to yes or no questions. For example, are you okay? Do you want to take some time before we continue? Would you like me to sit here with you for a while before we start again? And then really listen. Listen to what the student has to say. It can be a big risk for a student to open up to staff. Sorry, Brian. My dog is barking. One moment.
Yeah,
Brian, you want to pause it?
yeah. Pause recording.
Then really listen. Listen to what the student has to say. It can be a big risk for a student to open up to a staff or faculty member. So to provide them the space to listen can feel very supportive in itself. And it can also be helpful to engage in active listening. So active listening is a two-part formula. The first is to just listen to what it is that they're saying. And then the second part is to convey your understanding by reflecting back what they're saying. And this might sound simple or intuitive, and if it does, that's great. But sometimes it can be more difficult than you think to sit with someone's feelings. It's easy for our anxiety to rise, and people often go straight to problem solving or giving advice. So why not go straight into problem solving? Perhaps you can remember a time when you've confided in a friend or family member and they start to give you solutions. What does that feel like? Or what about a time that maybe you were telling someone something that was upsetting to you and they told you that you shouldn't feel that way? What does that feel like? And what message might it convey to them if you try to fix their situation? Perhaps that their concern is not valid or that you're feeling uncomfortable with them talking to you. So before providing suggestions or before referring them to CAPS, just remember that one of the most important things that people crave is understanding, to feel like their feelings and their experience is valid. And we'd like to emphasize that you don't need to fix any problems with them. It can just be helpful to first respond to empathy. That's what people crave the most is just that understanding and somebody that is hearing them. So rather than asking what you can do to help or trying to offer them solutions, you can first emphasize your presence. So saying things like, I'm here with you. Anytime you want to talk about the challenges that you're having in the class, you're welcome to come talk to me during office hours. You can reflect what they're feeling. This sounds really frustrating. And normalize their feelings. I think it's really understandable that with everything going on, that you're having a hard time focusing and completing assignments. And we also would like to encourage you to have patience in offering support. So students respond to loss and different challenges in a variety of ways. So some may be angry, some might be really sad, and some might seem absent-minded or kind of numb. And it's just important to remember that all of these feelings and reactions are valid, and it may help for you to just be able to sit with that. And some students may not want to talk. So if you're concerned about a student and you've reached out to them, you've offered them a space to talk if they need it, and they still haven't replied to you, that's okay. It's okay to just give them some space. And when students take the risk to open up to you, it can also be helpful to provide affirmations. So we're going to show you some examples of those on the screen here. Affirmations are recognition of their effort, appreciation of their strengths. They use positive language and can highlight past successes or future hopes. So here you can see some examples of that. And taking the time to provide an affirmation can be really powerful and really helps to make rapport stronger. And it can help to reinforce your students' strengths. So saying things like, thank you so much for being open about this, or I really appreciate your openness around this, or I can tell that what you're talking about is really important to you, or it sounds like you've been working really hard to find a solution. All of these are examples of affirmations. So now we're going to show you a role play that Brian is the student and I'm the faculty member. And Brian has reached out to me to tell me that he's been struggling in class and wanted a chance for us to be able to meet. Hi, Brian. It's good to see you. Come on in. I'm going to go ahead and shut the door so we've got some privacy here. And please, if you feel comfortable, take off your backpack and have a seat.
Thank you. Yeah, thanks for making time for me. I know I've been falling behind in class. I've been late and behind on some assignments, and I admittedly haven't been coming to a few classes. So I just wanted to check in about what I can do to kind of make up and make sure that the rest of the quarter goes well.
Okay. Well, I really appreciate you reaching out to talk about this, and I have noticed that you haven't shown up to class sometimes, and so I was concerned about you. So I was really glad to hear from you. Um, if you feel comfortable, would you mind telling me a little bit more about what's been going on?
Yeah, I've just been having a hard time focusing in classes and feeling really just stressed out about a lot of things. So it's kind of been making it hard to stay on track. I don't know, sometimes I feel like I just don't want to get out of bed or go all the way to class too. So sometimes I just rather stay home.
Okay, okay. Um, so I hear that you've kind of been having a hard time lately.
Yeah, yeah. I just feel like there's a lot going on right now, and it's kind of stressing me out. So I just want to make sure I can, kind of check back in and get going with the quarter in a better way.
I'm sorry to hear that. I know that that is really hard when you want to be doing better, but it sounds like it's been really hard for you that you've been having a hard time focusing and concentrating. And I especially heard you talking about how it was difficult for you to stay on track. And then I also heard you say that sometimes it's even been hard for you to get out of bed. And without having to go into too much detail, I wonder, how have you been feeling lately?
Yeah, it's been really stressful. I mean, just sometimes to don't want to go to class or leave home because it just not feeling really safe right now. So there's just a
Mm.
lot going on, and it's hard to just keep my focus on the schoolwork.
Um, so I hear that one of the things that's keeping you from coming to campus is that you don't always feel safe. Can you tell me a little bit more about that?
Yeah, I've just been hearing things, seeing things going on here and other kind of the UCs as well. And it's
I
just
see.
sometimes making it even just stressful to be around campus, see things, or maybe even anticipate some things happening. So sometimes I'd just rather stay home than try to deal with it all.
I see what you're saying. Well, I think I understand what you're saying. I'm wondering if you're referring to kind of the activity that's going on campus lately with some of the protests and just the world conflict that's been going on and how that's been expressed on our campus. Is that part of what you're referring to?
Yeah, that's part of it. Yeah, just sometimes with everything going on, I just don't feel like it's safe for me to keep going, and I don't know, I just feel like all the stress is getting to me.
Okay, okay. And it sounds like it's a really overwhelming time for you right now, and I'm really sorry that you're experiencing this. Um, Brian, one thing I heard you say was that you're not sure if you can go on. So, that stood out to me, and I just want to follow up with that. I wonder if you've been feeling hopeless or if you've had any thoughts of hurting yourself.
Kind of, yeah. I mean, it's hard to see anything getting better with the way that things have been going, lately, and so it just feels like more and more bad news and people getting hurt, and I just have a hard time kind of seeing things getting better.
Yeah, it has been really hard. I think that it's been impacting, a lot of people. I think that it has a really understandable impact. It's really hard to see these things day after day. And I hear that it's not only impacting you emotionally, but it's also been impacting your ability to keep up with academics. And, I want you to know that you're not alone. I've heard this. I hear some hopelessness talk there because it can feel like it's relentless and there's always something going on in the news or um, kind of the stress of being on campus. And I guess I just want to check out if you have had any thoughts about hurting yourself.
Not really. I mean, kind of thoughts, but nothing that I feel like I'm gonna take action on right now.
Okay.
The thoughts kind of come up and here and there when I hear about something and think about what's the point of keeping going if this is just the way things are going to turn out. But
Yeah.
I don't know. They're just kind of here and there.
Okay, so when you said that you were not necessarily feeling safe, I just wanted to check out with that and see if there was anything that I needed to get you some help right away. I want you to, well, first of all, I just want to say thank you so much for opening up. I really appreciate it. I think it takes a lot of courage to be open, and especially I know it can be hard to talk to your professor about these kinds of things. So, I really appreciate. I understand how difficult that this time is. I can hear that right now for you. Some of this I definitely can help with. We can talk about academics. I hear that one of the things I'm really hearing is that you want to improve with your academics, and that's something that's really important for you. And so I want to be able to help you get caught up. And so I want you to know that you can reach out to me at any time. And, I'm here. I have office hours every week that you're welcome to come into and take advantage of that. You can, reach out to me at any time if you want to talk or keep me posted on how you're doing. But I also wanted to, say that some of this I feel like I'm able to provide you support, and then some of it, I don't necessarily think that is in my specialty area. And I wonder if, sometimes when students are feeling down or they're having those kinds of thoughts of feeling hopeless or thoughts of maybe hurting themselves, it can be really helpful for them to go and speak with a therapist or a counselor over at CAPS. And I wonder if that's something that you would be open to considering.
Yeah, I've been thinking about it. I just haven't had the energy when I'm trying to get everything else together to go over there. And I hear sometimes it's like a long wait time. So I just feel like maybe I can just bear it out.
Yeah, I've heard some concerns about that too. I know that there did used to be a wait for CAPS, but they've hired additional staffing, and I know that they work really hard to make sure that the wait is not too long for students. In fact, I know that even if students need to be seen for crisis services, that's available same day for students. The other thing is that if you don't feel like you've got the time to walk over, they also have virtual services as well. So you can have phone appointments or video appointments. So, they try to make it as easy as they can for students. I definitely hear your concern. But I do want to reassure you that I don't think that the wait is that long right now. And I wonder if you'd be willing to even call. We could even call together if you would be open to that.
Yeah, I think I can call. I mean, yeah,
Okay.
I'm sure to do that. So yeah, it's helpful to know that, I might be able to check in with someone soon.
Yeah, absolutely. And again, Brian, feel free to reach out to me at any time. And just to emphasize with CAPS, it is, 24/7. So even if you're not ready to call right now, you can call at any time to reach out if you need some help with that. And then as far as the academics, let's go ahead and schedule a time where we can talk and might be able to figure out how we can help you with your academics.
All right, cool. Thank you.
All right. All right. Thanks for stopping by, and we'll be in touch.
In addition, there may be some brief strategies if someone is really stressed out or having a lot of difficulty even engaging or checking in with you. So, we wanted to offer a brief calming skill and a breathing practice in particular as one really helpful strategy that you can employ in the moment. And learning this for yourself can also help you provide this space and share this skill with students. Breathing practices can be really helpful because we always have our breath with us. And whether we experience a breath as relaxing or kind of promoting that fight or flight response actually depends on how we breathe. Breathing can really be quite complex. A basic principle of the breath is that breathing in is actually not the relaxing part, it's actually breathing out. Breathing in momentarily activates what's called our sympathetic nervous system, which activates the fight or flight response, while breathing out activates the parasympathetic nervous system, our rest and relax system. Taking pauses in between the in and out breaths also helps slow down our breathing to bring down our heart rate. So you'll see this visual guide here on the screen as a practice known as box breathing, a kind of breathing that breaks our breathing cycles into 4 different parts, just like a box has 4 different sides. Note that exact seconds don't matter. The important principle here is that we're mindful of how each part of our breathing contributes to the relaxation response. So we can briefly follow along with this, and I encourage you to pause the video or to take some time to really learn about this skill so that you can also feel like ready to share with the students that you're meeting with. So we'll hold here for a second and go ahead and take a breath in for 4 seconds. Holding now for 4 seconds. And breathing out for 4 seconds. You can continue to hold just a space between or continue breathing out. Practicing this one more time. And hopefully that gives you a sense. Again, I encourage you to continue with this and try to practice and learn this so that you feel comfortable then also sharing this with the student you may be meeting with. All right. And we want to offer some additional suggestions, recognizing that happiness and your activism can coexist. You deserve to be as nice to yourself as you are to other people. So in thinking about how do we manage the stress from our current social context, this will look different for each individual depending on their own values, mental health needs, and resources, but we wanted to provide some additional suggestions that may help. So it can help to limit and take breaks from media consumption, reading just enough to be informed, using resources that you can trust, or thinking about hiding or filtering feeds that may feel triggering or bring up a lot of discomfort. It can also help to avoid discussions and limit conversations that may escalate to conflict. So avoiding discussions online or with people you don't know, or people that you know to hold conflicting views can be another way to navigate some of the current stressors. It's also important to connect with your support systems, find and connect with family, friends, groups, campus spaces, things like that can be really important recommendations and suggestions. And also, if it feels engaging, rejuvenating, there are important matters that are happening around the community at state level, local level, and particularly on campus that can be that can help to be a little bit more engaged and involved in. Additionally, it can help to make spaces in the spaces that you are offering to students and meeting with them to talk about these things. It can be helpful to acknowledge the social context as you're checking in with others, if you're giving a presentation, providing a lecture, or just as we just demonstrated, checking in with the student. So really naming those can be very helpful. It can also help to encourage that social connection, that social support, providing those spaces and making space for that wherever you may be meeting with students. Having flexibility, adjusting expectations, particularly if there's a lot that's affecting a lot of the students that you're working with. Encouraging self-compassion and people to practice some kindness to themselves and understanding of themselves and giving themselves room for self-care and for checking in with themselves. It can also be important to encourage and support some of those social change endeavors. So to talk and name a few ways people can act and get involved in participating in change in some of those events or experiences that they're having, particularly at the campus, state, local level. And similarly, help them channel those political passions by helping them connect with those ideas or think about ways that they can navigate some of these challenges that they're seeing.
All right, and next, we'd like to move into how to refer for additional assistance. CAPS is the department on campus that provides mental health support and counseling to students, and our team is made up of licensed clinical social workers, psychologists, psychiatrists, and postdoctoral residents. Our staff are culturally diverse with a wide range of identities. We offer both in-person as well as virtual telehealth appointments. Our clinical services include individual counseling, in which a student meets one-on-one with a counselor. We provide brief individual counseling with a limited number of sessions based on the student's clinical need. And many students find 3 to 6 sessions helpful, and we're able to make progress during this time. If counseling beyond the brief model is recommended, we will discuss various options with the student, which may include a referral to an off-campus service. Another service that we offer is group counseling. So some problems are better addressed together in a group, and we have several groups in which students get the unique opportunity to meet weekly with a CAPS staff as well as get support from other students who share similar experiences. So examples include groups on how to build social confidence, improve relationships, and manage anxiety. Some students will also be referred for medication treatment with one of our psychiatrists. Our services are free for undergraduate, graduate, and professional students who have paid their student services fee, and this means that they don't pay for any appointments at CAPS. CAPS services are also confidential. This means that CAPS doesn't share information that students share with us, except for extreme situations. And we discuss that with students. We also offer CAPS services in various languages in addition to English, including Hebrew, Mandarin, Spanish, and Taiwanese. This slide shows you our community connections for this quarter. Community connections are spaces that are designed for students who share similar identities or similar experiences. They provide a safe space to discuss unique issues to a particular group in a supportive manner. And students can build relationships, learn from each other, and participate in meaningful, engaging conversations.
Additionally, we do offer crisis services. So if a student is experiencing an urgent need or crisis and needs to consult with a mental health provider immediately, or if you yourself are having concerns about a student and want to help them navigate this issue, you can call CAPS and request to speak to a counselor over the phone 24 hours a day, 7 days a week. And this does include weekends, holidays, and late nights and evenings. Please don't hesitate to call us. Help is just a phone call away. We also want to advise you of our Triton Core team, which is a mobile response team at UCSD that provides compassionate intervention and support to students experiencing a behavioral health crisis. The Triton Core team is composed of licensed behavioral health professionals that are equipped to engage in a mobile crisis response. They can conduct behavioral health wellness checks and can also provide in-person or telehealth assessment for students facing behavioral challenges. They can also help with students facing substance use related crises and other forms of distress. Anyone can call and request Triton Core response for students that are on campus. You can speak with one of the Triton Core clinicians by calling the UCPD non-emergency line at the number listed there, 858-534-4357. The team's current hours of operation are Monday through Friday between 10 a.m. and 10 p.m. Outside of these hours, the operating procedure remains calling UCPD to respond to calls coming through dispatch. Students may also present to urgent care at CAPS in Galbraith Hall between 8 to 4 p.m. on Monday through Friday to also access emergency mental health services. And a few additional support resources may also be helpful to consider. First, the Triton Concern line can be used to report concerns about distressed students or students with whom you may have a concern about. You may also consider connecting the student to their Dean of Student Affairs within their college or program, as they can also reach out to students to check in. Student Affairs Case Management Services also offers various other resources for faculty and staff looking for additional ways to support students or navigate concerns around campus. So this can include a guide for supporting students in distress, something called the Red Folder. There's also a faculty and staff resource guide with many helpful resources available around campus to faculty and staff. Additional videos for responding to students in distress, and also health and well-being syllabus statements that can really encourage students to check in with you and discuss some of their concerns to get connected to support and resources. And lastly, campus community centers can also be great places to support, to refer students to based on an identity that they may hold. And so this can connect them to community affinity spaces, attend events to process or receive support around world events impacting their community, and receive additional support resources that these centers may have access to. And so that brings us to the end of our presentation. Thank you for joining us today.